I'm talking today to Dr. Liz Sigston, who is an ENT surgeon down here in Melbourne, among many other things, but we'll get to all of that. Thanks, Liz, for your time.
It's a pleasure.
You're a wide-ranging person, aren't you? You're a surgeon, you're a CEO, you're an entrepreneur, you're a researcher. You say your dad was in the Air Force. Are there any doctors in your family? Was it a...
No.
Not at all?
Not at
all.
all.
Was it always the thing for you to be a doctor?
No. I wanted to be a fighter pilot was my first career.
Well, of course you did.
But at some point I kind of realised that they didn't actually let women fly planes in the Air Force.
Ooh, yeah.
And when they did, they got to fly the cargo planes, which wasn't really very exciting.
So when did it finally click for medicine to be your...
Probably in about grade 10.
Yeah.
I always loved science, but I also really love art. And to me, medicine was the combination of taking the science and creating the art of healing. So it was the combination of the two.
Okay.
And that really appealed to me.
Was ENT always your first choice?
No, my first choice was actually plastics.
Well, there you go. How did you come around to ENT specifically?
Well, basically, as I was working at the Alfred, one of the surgical resident positions, and I did plastics and ENT in that year. And whilst I really liked the plastics work, the ENT patients were more interesting.
Yeah.
They complained less. They seemed to be more appreciative of what you did for them. Well, the people that come in often for doing plastics out of hours are the people who stick their hands through the glass window.
Right. Yes.
And then and go out and do it again. So it doesn't seem like they were overly grateful for the first time we fixed them up.
There you go.
But it was interesting. With the ENT patients. And even the head and neck patients, there was always an element of gratitude there, and some of them were, some of these guys are really, really interesting as well. So that really appealed, and the group of surgeons I worked with were really good to work with as well.
You've been quite outspoken about gender equity, particularly in surgery. There's been a lot of chat about it over the last couple of years. Are you happy with the steps the College of Surgeons is taking?
Look, I think it's actually been fairly incredible, the steps that they've taken. I think initially the ability to acknowledge it very quickly and to set up an independent committee to investigate it, within a very short time frame, and then to have the reports come through, which were not very positive, but to, rather than taking a defensive line, actually say, look, we accept that this is going on. And now that we're aware about it, we'll actually, we're going to put things in place to address it.
Yeah.
So I think that's a huge cultural shift.
Have you seen improvement since, or was it too early?
It's probably a little bit early, but there's definitely, if you're coming from the college, there's definitely a shift. I think at our recent council elections, there was a lot more women elected to the council.
Great.
I guess the difficult part is that the College of Surgeons isn't our employer; it's the professional body. So a lot of this has to be done in conjunction with the health networks as well. And Monash Health's actually been pretty proactive in that area. They've actually taken on board working with the College of Surgeons to introduce programs to help with bullying and looking at encouraging diversity across the spectrum in medicine.
What's the gender split like in ENT work?
At the moment? Well, in our state, it was interesting. We actually had a ladies' dinner on just the weekend past, and we must have, I think now, close to 20 qualified ENT surgeons that are women in Victoria.
Right.
But we don't necessarily see all of them in public practice.
Right.
Or in, I guess, a lot of public practice. So at Monash, I was the only female for a very, very long time.
Yeah.
We now have a second female ENT surgeon, which is really nice. So Jo specialises in rhinology.
Right.
But we have a unit of 20 surgeons, so we're still pretty much in the minority.
For sure. And how did that impact on your training and your early experiences
It was very interesting. I was lucky. I did general surgery first, and things have changed quite a lot. I was initially based at the Alfred, and our director of surgery, Chris Christofi, was very, very supportive of women going into surgery, and we had a lot of females going into surgery at that time, so it wasn't quite so unusual. It was more when you sort of started getting out of that environment that you became a bit more aware that that wasn't maybe the norm. It's quite interesting. I had my first daughter when I was a third-year resident, so that's before I was on any training program, which wasn't really done. So I sort of kept it quiet for quite a while, and in fact I don't think anyone apart from the administrators knew that I was pregnant until I was about 32 weeks pregnant. Wow. And then one of the comments was pretty much and it wasn't meant in a negative way or to be discriminatory. It was just that it was sort of like, well, when I went through, if you're a man and married, you weren't going to do surgery, but you're a woman, you're married, and now you're having a baby. That's like that's really pushing the limits a bit.
So did they wonder how you thought you were going to get this done, or?
Yeah, possibly.
How did you get it done? Because it's not easy.
I probably didn't think about it too much. It's sometimes I think when you just bite the bullet and you do things, and you just trust you'll find a way.
Yes.
And it's amazing what happens when you do that, and you kind of get through it, and it's just like, wow, I don't actually know how I managed it, but I did.
Yeah. Am I right in saying you're a breast cancer survivor as well?
That's
Are you
correct.
happy to talk about that? Or?
Yeah. Yes.
When did that all happen?
So that was about 10 years ago. So after my training to do general surgery, then I moved into ENT, and then I did a fellowship here, and then 2 years in France. When I was in France, my marriage kind of fell apart.
Yep.
And then I came back here and just trying to get my feet back on the ground, and about 12 months later I actually developed breast cancer. Yeah, it was sort of like, it was a bit like getting hit by multiple trucks at once. It was interesting because in some ways it made me stop and really reflect on my life, who I was, what I wanted to do, what was important to me, and gave me time to do that. That as a medical professional, we really don't put time aside to do that sort of thing, and it was actually really special, and it gave me different outlook and a different view to how I think we need to move forward in addressing healthcare.
Right. Did it make you a better doctor?
Absolutely. I think the being able to have that real empathy is important, but just being, I guess, a lot more aware of what it's like to be in that position. But just I guess taking a more holistic approach to things, and one of the big things I think is developing gratitude, and so it was a time for me to actually practice myself to develop that, and then that's something that I can actually pass on to people that I speak to, and particularly we don't always necessarily have the opportunity to cure someone, but there's still that ability for them to be grateful for what they have or what they have had.
Yes.
And when you sort of really start connecting with that, it actually changes the way that your body feels and operates, and actually changes your physiology. And there's some really good evidence to show that actually probably helps the immune system, which ultimately is what we want when you're dealing with a lot of disease, including cancer.
Did that all connect in with your starting to get involved in the environmental movement and conservation and things?
Yeah, it was. It was sort of, I guess, that ability to look around and I guess really appreciate we're a lot more interconnected than we often take time to recognise, and so the environment's actually really important. If we have an unhealthy environment, we can't expect to be healthy. So whether that's from pollution or from dirty water, or just being able to go and sit somewhere in a park that it just does magical things for you. So if we're not looking after that, we're going to lose that for future generations. So
you're the founder and CEO of a company called Saving Green. Tell us how that came about and what the company's all about.
Yeah, so that was a little bit of a sideways step. So I had seen Al Gore's movie, Inconvenient Truth.
Yep.
And I think that was in about 2008.
Yep.
It was sort of like there's a lot of talk about, yes, you know, we know there's a problem and yes, we're going to do something.
Yep.
And just continual talks about how difficult it was, how much money it was going to cost, and while we all really wanted to do something, it was coming across that it might just be a bit too hard. And you know, and I really believe that change comes from the community and small business. It's not going to be driven by government and big business. And so I thought, well, you know, I can do something about this if we create a business model to let us make a difference. So by people just choosing to use whatever services we're providing, and we can tie that to a positive environmental outcome. So basically, Saving Green provides telecommunications. So we do phones, mobile phones, internet, business services.
Wow.
And when people choose to use our services, then we make a contribution to carbon neutral to plant trees. And we also do that with energy brokering. So instead of trying to get people to buy green energy, which intellectually and emotionally sounds really good, up until now that has been more expensive, and that's a big barrier for people. Whether we like it or not, you know, often, you know, there are limitations. So we, you know, find something that's a good plan or a good price, and from commissions we earn from that, we put contributions to planting trees.
Fantastic. How many trees have you planted over the years?
So we're now up to over 60,000 trees, which is really impressive.
It's a forest.
It is, it is. And the great part is that Carbon Neutral do biodiversity planting,
right?
And they're actually now recognised as they've got gold standard certification, which is an international recognition of the work that they're doing and the level that they're delivering.
Mm-hmm.
And yeah, so that's really the only ones in Australia that have that standard, which is really great, and it's wonderful to have a partnership with them.
Fantastic. If you want to check out Saving Green, go to www.savinggreen.com.au. There's only one G in the Saving Green, all one word. How much has that diversification of your interests balanced out your life? Has it been a really positive thing to do?
Yeah, absolutely. It helps keep you aware of what goes on outside the medical profession. Quite often we can become quite isolated and very much in our own little world. And you know, sometimes things that we see as really big issues, when you take a step back, may not be quite so big. But things that we may not see as issues, you suddenly realise they are.
If you had a room full of students in here right now and they're thinking of what to specialise in, what would you tell them about ENT first of all? But what would you tell them about the broader life of a doctor and what they should be, or what would be best for them to do?
Okay, well, to start with ENT, I love ENT for a number of reasons. I love neck anatomy, is my favourite part of the anatomy.
Why is that?
I don't know, it's just
complicated as hell, isn't it?
It's complicated, but it's, I don't know, it's just interesting. It interests me. But ENT has quite a good variety in it. So we do everything from neonates to, you know, people at the other end of life. We deal with a variety of different basic operations. So it can be, you know, from paediatrics, it can be tonsils and grommets, but then it could also be some complex paediatric airway. And you go through, you know, we do sinus surgery, you know, there's head and neck, there's ear surgery. So there's sort of a bit of this choice. And as you can probably guess from what I do, I like variety. So that was an important choice for me, to have something where there was a lot of variety in the base work that you do.
So to the wider issue, what would you tell those students about how to conduct their career and stay happy and sane?
Okay, now it's definitely a challenge, and I think the first thing is to remember there's more to life than just being a doctor or being a surgeon. And probably I'd actually advise, don't think of it as you being a surgeon, think of it as you doing surgery. Yeah. And then that allows you to discover who you really are, because if you define yourself simply by what you do, you're limiting your capacity. But also, if anything happens, you don't stop to exist if you can't stop operating. You're still there. So you need to have that real sense of who you are. So it is important to invest time into personal development, developing some leadership skills. Whether you think you want to be a leader or not, they're very, very valuable to have, because you'll probably have a private practice at some stage. You'll be training registrars at some stage, so those skills always will come to the fore when you're in those situations. Make time for your family. Yeah. Don't sweat the small stuff. So get yourself a cleaner, get yourself someone to do the garden. Don't worry if the house is a mess. It's actually not that important.
If your 22-year-old self walked in the door, would you recognise each other now?
Probably not. But I think I was definitely a lot shyer. Yeah. There's certainly part of me that was confident in what I wanted to know, but even 5 years ago, I was a lot shyer than what I am now. I wouldn't be talking to you probably. Yeah, I'd be very different. So, and it's just interesting, and I think that confidence and that has been built from doing things actually outside of medicine,
right, rather
than staying inside the structure.
Yes.
And it just lets you to discover more of who you are, which is very fulfilling.
What do your colleagues think of your outside activities?
I don't know. I don't know that they all understand exactly what I do. I think they think it's pretty good.
Yeah.
But sometimes I think that other people would like to be doing things outside of medicine, but aren't always sure how to take that step out. It can be quite hard when you're locked into a private practice and you have overheads and you maybe haven't had time to develop skills and things. So there's risk in doing stuff outside what you know. But at the same time, risk equals reward. So if you're prepared to take the risk, then the rewards are there as well.
You clearly love what you do, and you love the way you're doing it.
Yeah, look, I think once you understand what your driving needs are, and I guess this is really important for everyone because they'll be different.
Yep.
But my driving needs are really around variety, growth and contribution.
Yeah.
And, once you start working, once you really have those identified and you start working, doing things that contribute to that, it's really, that's when life becomes really satisfying. So it's knowing your needs, knowing your values and knowing your purpose.
Thank you for your time.
Thank you.